Hello, we are back with another session of Materia America Marathon. Alphabets N O with our very beloved Navneet Vachhani bhai. Dr. Navneet Vachhani is all I know about him actually is through his Instagram profile that he's a very hard-working doctor, and he's a student from one of the most respected colleges in India, ML Dhawale College, Palghar. Hello, Dr. Chandra Posh. How are you? Hi, Shwe. So I hope we will have our very dear guest from Junagadh, from the soil of Gujarat, and that is why it is bringing so much of smile and happiness to me, because finally two Gujus meeting on this marathon. I hope you all had a very good time during Ganpati Visarjan. From people from Mumbai really had the blast of their time, blast of their year. We have two alphabets today with very important remedies on the list. Good polycrust remedies. I hope we get a lot of insightful knowledge from Navneet bhai. And Navneet bhai keeps sharing. Is a very authentic, I think that he has a very sound knowledge from Bogar and Boni Mission, because he keeps sharing tips of case taking, of repertory. So when I invited him, the first thing that he said is, right, I'm not a Materia America. I said, you are a homeopath, and that's most important, especially the kind of knowledge you are trying to give it to students and the kind of videos that he keeps sharing. So that's really encouraging, and that is very low voice. Am I audible? It's almost inaudible. You are not that audible. Am I audible? Am I clear now? Can you guys please check once again? A young author, Dr. Shyam Kumar Vaishnav, is here with us. Guys, just do a... No sir, not that audible. Can we do a audio check? Where am I audible? Navneet bhai, please join in. Okay, Shwet says audible means audible. And Dr. Pooja Gori also did thumbs up. Bhai, ghar bhi sambhalna hai. Navneet bhai, please join in so that we can start today's session.
Okay, so a lot of people putting up thumbs up that I'm audible. So we are good to go with the session. And Navneet bhai is here. Hello, Navneet bhai. Navneet bhai, आवाज નથી આવતો. Is it audible to you guys? It's not audible to me. Can you all hear? Jitesh bhai is here in the house. Okay. I don't know. It's not just audible to me only. Can everybody hear Navneet bhai? Navneet bhai? I don't know. Something. No, sir. Okay. Sir is not audible. Navneet bhai, mute તો નથી ને, જોઈ લેજો ખાલી. સામે mute તો નથી ને. We are not able to hear you. Just check your Bluetooth is not connected, na? If you are disconnecting your Bluetooth.
Is fine. Actually, I'm using without it. Okay.
Now you're in. Now you're in.
Fine. I'm in.
Navneet bhai.
Okay.
Hello. How are you?
Fine. Okay, Abhishek. So
nice to see you. First time we are meeting in like
Yes.
though online, but
Yes.
first time we are talking one to one.
Okay. Yes.
I must say I'm a big fan of whatever you're doing
Arre.
online through Instagram.
नहीं
However,
नहीं.
you're trying to spread as much as authentic knowledge, and I really appreciate it,
Yeah. Okay.
Navneet bhai.
Thank you. Thank you, Abhishek.
Navneet bhai, let us start then. चालू
Yeah.
करिए.
Sure. Sure, Abhishek.
Okay. The first remedy, Naja.
Naja. Okay. Naja, Abhishek. We are talking in Hindi, English, which
Whatever
your
language
usual
you're
live.
comfortable. No,
Okay.
all
Anyway,
the lives are
fine.
in both the mixed languages.
Okay. Fine. Okay. Naja, see, I have not used many times to be say any very, so we can say verification about it. But whatever I remember, I had discussed one of a case with my colleague, and we were discussing the case of one lady, and we were confused between, we had some shades of lachesis, but it was not purely lachesis. The patient was too good for lachesis in a way, and we were getting some tinge from Oromet also, so that nobleness and all. So on a mental basis, we decided to Naja. So the point is, whenever Naja is coming to your case, I didn't see any direct indication, or we can say it didn't come up directly, but rather it will come up through lachesis, or you are not sure about lachesis, or in the DD of lachesis, even at a constitutional or mental picture level, or even at a physical level, where you can see a lot of matching with lachesis, like left-sidedness, the choking and constricted feeling, and all those things. Being a poison, it's mostly of a neurotoxin, so we don't see like other blood pathologies like Vipera and other Ophidia. So mostly heart condition is there, but most of the valvular features are there. Not, I wouldn't say any confirmatory symptoms, because I haven't used that much frequently. What's your experience about it, Abhishek? Naja?
So Naja, I have honestly, I learned Naja's all clinical conditions from my guru, Dr. Farooq Master sir.
Yes.
So Naja, he has used it. I actually used all the poisons, Ophidia group very extensively. So this is one of the poisons which I learned from him, and then I have confirmed in my practice also. That
Yes.
exactly what you said. It is very close remedy to lachesis. Like all symptoms, you'll find it with lachesis, very closely going with lachesis. It separates out in lachesis, but on a level of its heat sensation, on the level of its the tightness which we say is of that the tight clothes are not wearable. All that is more marked in lachesis, is less marked in
Lachesis.
Naja.
Yes, yes.
That's why it's getting separated. But this remedy is more of a cardiotoxic, I would say, along with the neurotoxic. It's a very cardiotoxic remedy. That's why it has a very marked action. It's on the left. It is mentioned as in Boger also, that it's a
Left
from left-sided heart failure to going down to the left ovaries to the leg pain, everywhere.
Yes.
The left-sided affinity. Also, on something very contrary to this, what is mentioned, I've seen it in right ventricular failure also. Mitral valves, as it is written, absolutely correct that it is very good remedy for mitral valve prolapse, mitral stenosis.
It's written in Boger.
Also one of the, yes, it's written in Boger, and it is definitely confirmed. And the words which are mentioned here is very important. That it is Boger mentioned sepsis.
Yes.
So
Collapse and sepsis. Yes.
Prolapse and sepsis.
Collapse.
So collapse and sepsis in kind of a multi-organ failure when the patient is landing up, and you will find all the confirmatory symptoms of the generalities. I think this will cover up in a very big way. And again, like all the previous remedies that we have studied in the previous sessions that we have done, again, this also has a very marked action on atrial fibrillation. Atrial fibrillation it's a very good remedy for atrial fibrillation.
It's one of the very we can say heart remedies. One of the group of heart remedies we are having. Naja is one of them, especially in valvular condition.
Valvular condition, and it goes very, very close to Adonis. That's one. The effects are very close to Adonis. So that's it about and hypertrophy of heart. Few people are writing. Jitesh Bhai has written bulbar palsy. That's true, Jitesh Bhai. Thank you so much. And anything else? Nahi to let's go to the next remedy. You have
Yeah.
something to add, Navneet Bhai?
No, not for Naja.
Okay, let's go to next remedy, that is natrum carb then. Rheumatic carditis. Yes, Ashi Jain.
Yeah.
Thank you so much. Rheumatic carditis is a very and strophanthus. Yes, Vansh is writing strophanthus. Yes, Vansh. Okay, yes, sir. Natrum carb.
Natrum carb. Yes, natrum carb. Since beginning of my practice, usually I didn't find many easily the natrum carb patient. But once I used to grasp its basic or important indication, so now it is coming very easily. Usually I used to give natrum mur when natrum carb was indicated in the we can say in the very initial days of my practice. So somehow I realized that this patient is not natrum mur and natrum carb. And then natrum carb, that sort of indication or the we can say totality gets confirmed again and again. So mostly I used natrum carb in a patients where there is a definite aspect of natrum as a group at a physical level also and mostly at a mental level. And you will not find a very strong characteristic of natrum mur which are there. They are lacking in this patient. So somehow you will feel that I want to give natrum mur, but there is something missing. Then when you realize it or when you read the natrum carb, it will be beautifully fit in natrum carb. So there is a aspect of carbonate also, carbon. So it's a chili than natrum mur.
Yes.
Mostly I have used in gastric as well as this type of headache, sun headache, even in migraine and different gastric disorders, mostly dyspeptic disorder and all. Other, I would say, the Boger has given in region, we can say in the sphere
Yes.
of action tissues, uh, skin as well as back of hands.
Back of hand.
Yeah. So the basically Boger का जो ये tissue है, oh, it is so much important. It also describes the general aspect of sphere of action as well as very peculiar aspect of that particular remedy. So in some cases, I also used natrum carb. Recently, I had given one of case. She had a dermatitis all over here, total till here only, in both of the hands. Redness, thick skinned, dry skin, itching, and all those. Very beautifully healed with natrum carb. So it covers sort of that skin condition also. The typical location, very characteristic location. Though natrum mur also is knuckles and all, but these are the typical back of hands, whole till here. So that is one aspect of it. Another we can say milk aggravation as well as milk aversion. Both you can find in natrum carb, which mostly aggravation I have found in majority of my cases where I have prescribed natrum carb. That's it. I whatever I can remember. Any other indication? No. Skin, GI, and migraine and headaches. So I have used mostly in this condition whenever the picture of mental and other generalities matches.
True.
Mostly they all were chilly. They all had a sun aggravation as well as some sort of more or less gastric disturbance as a concomitant.
Yes.
So this is what my picture or which I usually give on it.
True.
Anything to add?
No,
Abhishek?
like lot of people are writing that is very true that
Yes.
the gastric disturbances come out in the form of milk intolerance.
Yes.
They have a milk intolerance, and the chilliness
Right.
comes from the carb factor, which you rightly mentioned that they are chilly. So basically, this chilliness comes from the carb factor,
Carb.
and natrum gives it the gloominess. What the
Gloominess and sort of
the brooding
sadness,
brooding.
even sensitivity also.
Yes, the sensitivity.
Yeah.
So there is a psychotic factor which is there, which brings up the
Yes.
puffiness. There is a puffiness, and this psychotic miasm will bring up a lot of collection of thoughts in the psychological base also, and the same when it is reflected on the body, you will see this puffiness of the ankles, puffiness below the eyes, and oversensitive of the nature. And just one thing, what you rightly, what you absolutely mentioned, that this sensitivity is in all things are there. What I just wanted to add, just one thing which I want to add is that recently when obviously like what you said, that we always in the initial kind of the practice we'll always give one for the another, natrum carb for mure and mure for carb. We only, and one very good point what I learned through my practice, that there was one case and this lady had had irregular menses, basically not PCOD, irregular menses, and she came to me when she was 38 years old. Now 38-year-old lady, and she said, since my menarche I have been having this problem of I said, but she said, I have been taking treatment. I did this, I did that, मैंने छोड़ा नहीं treatment. I said, yeah, this is very shocking, because at certain point, no, you give up taking medicines.
Yes.
I don't want to. Like and then I saw that maybe we can take it in a way that this is perseverance.
Yes.
She's not leaving the disease. She wants to get cured. So in perseverance, when I saw, no, I could match up everything, and natrum carb is a very good remedy in the
sometimes
natrum carb covers perseverance also.
Sometimes
so
sometimes the indication comes up through very unusual aspect of the case, and it just strikes us that I look into this rubric or this remedy, and that's it. The whole picture matches afterwards.
Yeah,
so it happens.
It was my own just a little bit finding that natrum mure and mure will give up very easily, and natrum carb is a very good perseverant remedy.
Yes.
So like all the other things that you have said, I just wanted to add perseverance as one of the important things. The rest, all things are mentioned very clearly, and it is replicably evident in everybody's practice, whoever is doing this sensitiveness, gloominess.
Yes,
there is
it's there in majority of cases.
So you'll see in majority, and a lot of people, what you have really mentioned is aggravation from sunlight. Aggravation, sunlight, thunderstorm,
it's
aggravation.
almost there.
Yeah, so these are all there. Okay, bhai.
And one point to add to it, Abhishek, the perseverance. It's the personality. If we understand the perseverance with the background of natrum carb, it's sort of very easy perseverance rather, and not a strained one. In certain kind of remedy, you will see perseverance, but there is a lot of effort behind it.
Yes.
Natrum carb is a bit of a easy way because of the carb element rather.
Because of the carb element, he wants to do it, but he'll choose a softer way to do.
Yes, but not we cannot find that obstinate with perseverance, but the very easy way to persevere. And you will not find any we can say bitterness which will you get in natrum mure.
Yes.
And another point to add, or we will complete it with this, the very close remedy which are coming with the mental picture are, one is calcarea carb, another is pulsatilla, which are mostly coming up nearby, or either you can get entry into natrum through this remedy when you are exploring the case and all. So this is about it.
Yes, I agree. Rana ma'am is saying that they are dependent. Yes. Let's go to natrum mure. Almost we have spoken a lot of things about natrum carb and mure together, but some special features that you must have seen.
The very I was prescribing natrum mure with the typical indication, what we find all grief and hot patient, craving for salt, and dry skin, sun aggravation. These are very usual, or we have in the top of our mind for natrum. So they are very easy, or almost everyone knows it. But once I realized from my teacher and some reading of some cases that the typical mind picture of natrum, what हम सबको जो पता है about natrum, right? So that is of a grieving lady after breakup, romantic, but after breakup she is disappointed and sad and depressed. So the question came up was, how is the natrum before breakup? Right? Mostly we don't think, or we even miss it if we don't find the history of disappointment or sometime deception or this type of breakup in the event. In the life history of patient, or if it doesn't happen, if it didn't happen in the case, so we may miss it. So I tried to look into that thing. So I could study, or I could get that there are two type of pictures mainly we can have even before breakup. The natrum is intact and not broken down. So one is of totally opposite side, romantic as well as highly energetic person. You can have some the hysteria which have written in many materia medicas, hysteria part. You will find those hysterical features in immoderate laughing or exhilarated states. They and typical the sensitivity also, but you will not find that disappointment or even bitterness. They are the sweet level. So this picture I was able to give some cases. In some cases, the natrum mure, and they are going good with it. Another is typical one, the very serious, reserved, sensitive, not matching easily, and sort of hurt easily. But there is no history of even disappointment or breakdown. But still, you can feel that typical classical natrum picture. These are the ornamental plays. In I can say I was treating one patient who is a teenager having a lot of issues with parents and all these things, getting headache. When coming from school, getting headache every day. So I first gave उसको कैलक्रिया फोर्स दिया, जो टिपिकल स्कूल हेडेक है, टीनेज है, ग्रोइंग एज है, तो कैलक्रिया फोर्स दिया, काम नहीं किया. फिर जस्ट थोड़ा एक्सप्लोर किया तो पता चला कि जो टीनेज में एक्सप्रेशन उसका थोड़ा अलग रहता है. सो दिस टाइप ऑफ आर्ग्यूमेंट इज द एक्सप्रेशन ऑफ बीइंग हर्ट एंड इमोशनल सेंसिटिविटी. So the point is, typical adult और after breakdown natrum रहता है. उससे पहले जो होता है, those indication can be identified when we study the classical books, rather our old materia medicas, or even sometimes if we refer source books also. So, and if we give enough attention to the symptoms rather than the whole story, right? Story we usually all read and we know also. But when we try to understand the picture from symptom, then you can give even in a different situation. The natrum, we can say prototype or something. These are on a mental level. Otherwise, physically, it's a typical indication. I have found hot patient, sun aggravation, dry skin mostly. Another typical is usually perspiration on upper lip as well as nose. In majority of patient I have observed, and thirst. These are the usual kind of physical generals which can confirm it together. Yeah. Any clinical thing to add from your experience?
No,
Special,
I think
special any?
no. I think whatever you said, no, is all. I just totally agree. I just want to highlight on one thing, that all pathological changes or psychological changes, whatever will start with the deficiency of nutrition. So basically, this thinness, the deficient nutrition, maybe in the maturity, maybe in the maybe whatever thinking process they have. So this introvertness, the oversensitiveness will always make them take wrong decisions in their life. So this,
Yeah.
what it's mentioned in the first line is thin. Now this thin could be the thought, the maturity, the food for what we say, the food for thought is very thin. The food for the body is very thin. And because this line, no, it was, if Arkam, Dr. Arkam is there in the chat, is in the live, because I saw his name. Dr. Elam Khan had just made us read that which is the remedy which is thin, and what is the remedy in the Boger Veg it is, and he made us read this line.
Mhm.
And those and he just highlighted that इसको ऐसे पढ़ना चाहिए. जो thin है, वो thin है, thirsty है, hopeless and poorly nourished है. What this whole line, this itself is highlighted, and it itself, then if there are any students, you can write at least 2-3 pages just on the basis of this first line. And your answers when you're writing, no?
Just elaborate each word.
Just elaborate each word on physical mental plane, and you'll have two pages written there.
Yes.
उसके बाद आगे का देख लेना. And Atul bhai is writing consolation, aggravation. Yes, Atul bhai, this is all there. I totally agree with when you have this kind of low maturity, always taking wrong decisions, always falling for wrong people in maybe in their adolescence or even in their post-marital state. This is all very psychological. But in the deficient nutrition, when you see, you'll find out on the physical plane, most of the symptoms will be covered by natrum mure. And that's why there is anemia, then there is headache,
malnutrition,
and then there is calf pains,
and all
malnutrition. You see all being covered. You just have to stick to the basics of generalities, and then you'll have it.
Even in some cases, I have observed very good result. Even if there is no mental picture, and the word is chlorosis, which is written in old materia medica.
Yes.
The natrum is covering very nicely. The profuse menses with anemia and poor nutrition.
Yes.
And you will see that type of sick, we can say, structure, or pale face and all weakness and all this. This picture alone can be covered with natrum, even without mental symptoms also. Sometimes it works very nice. So that aspect is also, which we mostly miss because we are overwhelmed with other data. But we have started in the study. We then remind that third year, fourth year, we have read all these things. But it works nicely. But mostly in a lower potency when this type of indication is coming up.
Perfect. Next is Navneet bhai, natrum phos.
Natrum phos. We are covering a natrum session today.
Natrum family. Last time in the K we did Kali family.
Kali, yes. Natrum phos. The typical indication comes from the mostly in majority of my prescription is usually my style of selecting natrum is mostly coming through sort of synthetic, I would say, the natrum theme if I get in the case, and some aspect of phosphorus, even at a mental level as well as physical level, and we can say too close for phosphorus as well as too open for natrum mure. So you will find natrum phos somewhere between the if we see natrum as an introvert and phosphorus as an extrovert, you will find natrum phos somewhere in between. So it's not that close of natrum and not that too open or vivacious like phosphorus. So it will fall in between. And the other typical indication of typical sensitivity of natrum and all those aspects. Definitely you will lack bitterness in the whole picture of natrum mure. This is one aspect. Another is there is always, in majority of cases, there is always a gastric disturbance or mostly the acidity as a concomitant. The description has been like a sourness in general. Sourness, Boger says sourness, acidity, sourness of discharge, perspiration, and euphoria and everything. There is a sourness everywhere. So that is the key word given by Boger. And clinically, I have used in rheumatoid arthritis in some cases with the general indication, physical as well as mental picture. But beautifully, it works very well. And when I was reading it again, there is written rheumatism as a clinical condition. So definitely we decide on the basis of the whole picture. But when the sphere of action or tissue is covered along with the generals, it gives a good impact rather than just one part is covered, be it any physical or mental. So rheumatism is written in Boger. So when Boger write something, it means a lot. Otherwise, he would not write it.
Last time Dr. Sumit Paliwal sir had come, he said Boger ka one word is one page.
One page.
Boger will not write one word till he means it to be a one page. So that's
तो लिखा है तो उसमें कुछ होना चाहिए.
Yes.
There are few indication in rheumatism also, but I didn't find any very characteristic aspect of rheumatism in which type of rheumatism it fits. But in my cases, there where I'm currently treating 2 patients of rheumatoid arthritis. Both are natrum phos. Mental picture is natrum phos. Physically also. Yes. So this is one aspect of it. You confirm whether your remedy is covering that pathology, or we can say the pathogenesis as well as tissue, and then it will give a good confidence to you while prescribing. This is one aspect. Another is Abhishek, keynote of objective sign of the thick yellow coating at the base of tongue, which I
Base
have
of the tongue.
seen in many Natrum phos patients. So it can help you to confirm your remedy. I don't suggest to start with it, but still it
No,
can give you
definitely.
confirmation and confidence in it.
Yes.
So this is about Natrum phos. Another point I would say, no, but that's it.
Yeah.
And
So-
typically in acidity cases also,
Yes.
definitely Natrum phos is coming nicely. And one more, I would say, liver pathology also, it helps in some cases. I remember one of case where I was in my MD, and there was one patient didn't had a time to give whole case of whole history, right? So we just screen it out, the chief complaint and all. There was some jaundice का patient था, तो सर को दिखाया, सर बोले नेट्रम फोर्स बायोकेमिक में 6x में स्टार्ट करो और अगली बार पूरा केस लेना है, राइट? तो पेशेंट को नेट्रम फोर्स 6x बायोकेमिक में दिया. आफ्टर अ फ्यू डेज ही केम with much improvement in his symptoms and all. We defined the whole case, took the whole history, and the history came out of typical Natrum phos also. So sometimes the whole patient's constitution can come up through even pathology. But you need to identify that.
Yes. So true. I just one thing what I wanted to add is it in Boger it is written quite evidently in the region that it is the area of action is typically duodenum. So duodenal, when the duodenum, the functioning of duodenum, or if there is any malfunction of duodenum, there is going to be a regurgitation. There's a regurgitation will definitely lead to this what I guess somebody wrote about the regurgitation part. So this regurgitation will bring up the thick coating of the tongue, which will be yellow because there is liver pathology involved.
Yeah.
So that's why yellow coating of the tongue,
Everything.
because of the liver pathology and duodenal and the duodenal part. And one very good one very good parallel nosode, which I think I just want to highlight here is dysenterico. Dysenterico, if you read the kind of pathology given at the gastroduodenal junction, is absolutely matches to that of a Natrum phos. And wonderfully, everybody is putting down in the chat box also. It's a very good remedy if you don't know anything. Decimal scale mein Natrum phos for acidity.
Yes.
Okay.
Barabar.
Great.
Perfect.
Natrum sulph. Next,
sulph.
Natrum sulph.
Natrum sulph I have not used in mostly the typical constitutional remedy. Rather, the picture mostly sometimes I have used, but not too frequent to say much of a thing about Natrum sulph as a mental picture. Sometimes we can say, summarizing it, if we say about Natrum sulph picture, they are sensitive, but they will not seem sensitive as Natrum mur or phos can seem to you.
Yes.
Another part is sort of a seriousness rather than a gloominess.
Yes.
They are serious, and selflessness. This is one aspect which I have. This is it about, and clinically I have used in many cases of asthma, the typical psychotic asthma which is written, humid weather aggravation asthma symptoms, and also as a intercurrent remedy, Abhishek, in asthmatic patients, where the typical indicated remedy is going on, like we can say arsenic, phosphorus, whatever remedy is going on, but the response is sort of slowing down due to any aspect of it. The increasing repetition or potency may not work properly. Then few doses of Natrum sulph as a intercurrent remedy would help in those type of cases. So I have given Natrum sulph in asthma cases as an intercurrent in many cases, but not as a constitutional. Very, very few cases. Natrum sulph. Yeah. And sometimes it comes up as a synthetic prescription when typical Natrum.
Natrum and sulfur, both the features.
But that needs to be confirmed through other symptoms. Mostly I have seen many young students to play with the synthetic prescription like mathematics, but it doesn't work.
That way. It's not just.
Yes.
So I'll just add for the one important thing that immediately Shwet highlighted away is that it's a very wonderful remedy for post effects of head injury. So yes, it is a very good remedy for post effects of head injury.
Yes.
And one very important
Yes.
line which I wanted to highlight, which is given in bold in Boger, is rumbling, gurgling in bowels, and then sudden gushing noisy, spluttery stool. This comes in this comes in very characteristic with morning diarrhea, with a lot of people who have this thing when they wake up, which is a sulfur feature, obviously, that when
Yes.
they wake up, the first thing in the morning when they wake up, when they open
They have
their
to
eyes, is they have to rush. They have to rush. So this morning kind of morning diarrhea, morning sickness diarrhea, where a lot of people are something which obviously clubbed with a lot of liver pathology and gallstones, and if you have it with it, this is definitely going to be a good prescription. And definitely you can compare it with aloes. You can compare it with
Aloes can be. Yes.
aloe,
Yes.
and
Because of
it is
even sulfur element
yes,
is
sulfur
very
element.
complementary to aloes.
Yes, and also a very wonderful remedy for asthma, right? Like you rightly said, when you have juvenile asthma to start with, if you have features
Yes.
confirming, it is a very good remedy for, and also chronic cases of chronic cold cough and catarrh, where the patient has been complaining of yellowish nasal discharge in the
There,
morning. Yes,
yes.
so
It is closely
yellowish.
coming with even pulsatilla and kali sulph
Yes,
rather.
yes. Kali sulph and pulsatilla. That's absolutely right. And in Boger also you'll read it's a very good. It's in the complementary section. The pulsatilla is mentioned.
Yes.
So this is about natrum
Natrum
sulph.
sulph.
This is about
Yes.
natrum sulph. Next is nitric acid.
One more point,
Yes.
Abhishek, about
Yes.
all natrum. All
Yes.
natrum are sensitive to music rather.
But
The background may differ
the reaction,
somehow.
the reactions
Yes.
of them, the sensitivity of the music, we may find in all natrums, but the way they react to the music, then
And,
that.
and
Yeah.
even the choice of music may differ somewhat. Even
Yes.
natrum carb to natrum mute
Mute,
to
mute.
something.
Yeah.
I actually I am learning classical music. So
Sorry.
so I'm learning classical music since many years. So when patients say I like music during the history,
Okay.
yeah.
Sorry.
Okay. So when patients say I like music, I go dive deep into it. Which type of music you like it? So when he say classical music, so I go further deep into it. Which rag do you like most? And then I try to compare the feeling of that particular raga.
Okay.
Because every rag, like our remedy, have
Special affinity.
very selected set of feeling,
Okay.
or we can say state.
Mm-hmm.
So it would help sometimes, or it would rather give us, rather than helping in prescription, it would give us some exploration into it.
Okay.
So afterward, we can correlate or something. Definitely not an indication for anything.
Yeah. But
But
definitely,
when you are into both of
good
the
to
things,
study.
it will
Yeah.
give you some excitement.
Yes. Okay, bhai. Next is nitric
Yeah.
acid.
Nitric acid, the typical indication comes through for me, it's coming through the location, the orifices and the margin of the outlets rather. And even Boger write it tubular organs.
Yes.
A very
Tubular organ.
beautiful written. Tubular organs. It can be intestine, it can be anus also.
Yes.
So it can be even urethra also.
Yes.
So tubular organ in that way. He generalizes in such a way. So if you understand it, so you will be thrilled. Beautiful generalizing. One aspect of it is about location, which helps in indicating or confirming the remedy. Another is about pathology. Which type of pathology nitric acid is covering? Mostly the syphilitic one. Be it we can say fissures or be it ulcers. Sometimes in many cases of cancer, nitric acid is indicated.
Yes. Is an opening remedy.
Definitely. I have given in squamous cell carcinoma a few of cases with very good result, but typical, the mouth ulcer and all, a classic nitric acid picture. And one point adding to it, or we can say it helps to narrow it down. When you have this orifices as well as this typical pathology, another is hemorrhages, hemorrhagic tendency, bleeding. That easy bleeding if you add to it, then it will narrow down further very easily. Like you have some syphilitic or we can say fissure and all this ulcer and orifices as a location in graphitis also, in sulfur also. But when you add hemorrhages to it, it will help you to narrow it down to nitric acid very easily. This combination helps in selecting.
Yes.
I would see rather this way. Mentally, I have not given in many, I can say any cases, the nitric acid personality or nitric acid picture constitutionally. I have not prescribed nitric acid. Otherwise, warts, it works very well when there are large warts, easily bleeding warts. And beautifully, recently I had a case of one pediatric patient was there. The large wart was here in the pinna, and they were to a dermatologist for the lesser treatment. They were doing it. The doctor was doing the lesser treatment, and in between, patient had so much pain, and he got tantrum and refused to it. अभी करवाने ही नहीं दिया. So till then, till so many days, the warts, the half burnt wart through lesser was constantly bleeding. So nitric acid, few doses in even I think a lower potency, 30 I had given, to stop the bleeding completely and help to shrink that remaining wart also.
True.
So typical, we can say the bleeding wart as well as the orifices, the typical combination helps it. And in certain carcinoma patient or cancer, the remedy coming through your mind is first is nitric acid in majority of carcinoma, unless it's a different type of cancer like lung cancer or so. Another very interesting point Boger has written in modality is amelioration by steady pressure, right? Steady pressure. So I was not aware about it, but when I was reading Phatak's cases, Dr. Phatak sir's cases, there was one case of UTI and the cystitis it was basically, and patient was not better with allopathic medicine or some of homeopathic prescription. And the typical modality was patient was sitting by cross-legged and leaning forward and constantly applying pressure. And once she released this position, the pain was starting. So typically, Phatak conclude that it's not the position of cross-legged or bending forward, it's the pressure, the type of pressure is a constant pressure. So that steady pressure, amelioration, and the typical location of urethra and bladder, cystitis, tubular organs, and infective pathology, nitric acid helped her. So this is the case of Dr. Phatak. So I realized that how Phatak view the modality in detail. And there are only two remedies, nitric acid and spigellia in Phatak's repertoire. Only two remedy for this. So rather than remedy, it is very nice and
it's a background
interesting to learn how to see modality.
Super.
So that is the thing. Otherwise, बस आप बताओ और कुछ any other experience?
Nothing much, but no different experience. What people are writing in chat is wonderful. Whatever Atul Bhai has written last as a differential between aurum and nitric is superb. And what you said is true. Everywhere, everybody, it is confirmed that it is margins, mucocutaneous junctions. Yes. One of the very favorite remedies for homeopaths to start in the cases of squamous cell carcinoma, where you have the junctions. And also, I'll just one thing. Whatever it is written, there is putridity, there is exhaustion, there is necrosis, there is syphilitic miasm. Everything is true. But one thing, what I could just recall from the essence of Materia Medica, what Vitulka sir has mentioned, that it has Haggard look. Haggard look. When I studied, when I tried to just what it means is that that patient have that constant complainness, that they are not happy. They are not happy with whatever kind of a treatment you give. They are not happy in their life. They're absolutely unhappy people. So whenever they come, they'll always give you this complaint that अभी कहाँ बेटर है यार, कहाँ बेटर, अरे तुम्हारा कैंसर ठीक करके ट्यूमर से कहाँ कम हो रहा है यार, कहाँ So this is
Barabar.
the typical haggardness
Okay.
where a lot of people have mentioned truly that it is they do not accept any apologies, they do not forget, they do not forgive, and that's what takes them to the level of cancer.
Cancer.
What?
Yes.
Yeah, with that non-forgiveness, that patients who don't forgive for years and years to come. One of the cases of CA colon, which I got very good successful results when luckily this thing matched in that the उसकी मम्मी ने उसको बहुत young age में निकाल दिया था घर से बाहर, and she had to then elope and get married, and then she said, I never forgave my wife, I never spoke to my mom, and ultimately this is what I got CA colon. I used it in CA colon case, and wonderfully the whole pathology started reversing. Used in LM potencies. So
Yeah.
this is how the remedy works wonderfully.
Somehow, though not I have studied it, but this not forgiving may come from, we can say, profanity. So it has written, right? It is one of the remedy, very limited remedy of profanity. Profanity, it's non-religiousness or like that.
Yes.
Something. So that sort of, if the person is
Hardness.
profane, right? So there is a lack of sensitivity or the view to look at the things or problem or to solve the problem would be like this. I would not forget or I would not forgive. So that can be associated with somehow. But I think it is still to explore a lot of things about nitric acid mind.
Definitely. Okay.
Yeah.
Next remedy is by Nux moschata.
Moschata. Again, Nux moschata not used frequently, but mostly indication. If I remember, not remembering any particular case, I myself have once I had a dengue, and I was describing my symptoms to my friend, and I was thinking I'm constantly drowsiness है यार, कुछ आप मुझे कुछ सूझ नहीं रहा, अभी हेडेक बहुत है, तो दे दो, आपको क्या लग रहा है देखो. तो वो बोला एक काम करो, ड्राउजीनेस है, नक्स मोस्काटा ले लिया भी, कुछ फर्क नहीं हुआ था because it was too severe then. But the main indication coming from this, I think, one is this overpowering drowsiness or sleepiness. Another is thirstlessness, and the typical, maybe it's a chilliness. So it's very strong, all these three features. Whenever वो जो है ना एक्यूट वाला प्रेडिक्टिव होम्योपैथी का, फर्स्ट में क्या चेंज है, फिर थर्मल में क्या है, और ये स्लीप का एक्टिविटी का अप है या डाउन,
एक्टिविटी अप डाउन.
यस. तो वो ये जो टिपिकल कॉम्बिनेशन है वो काफी प्रोमिनेंटली इसमें आता है. कुछ रेमेडीज में कुछ एस्पेक्ट स्ट्रॉन्ग है, while thirst or thermal aspect is not that strong, but इसमें तीनों अच्छे से strong है. उस हिसाब से एंट्री ले सकते हैं, but from experience nothing to say on any verification or these things.
So like Rihanna ma'am wrote that it's a very good remedy for hepatic NCAF. So obviously when these three symptoms come up, it's a very wonderful remedy. But what I have seen in like my practice is obviously this overpowering drowsiness, and it comes in thyroid crisis very frequently. All these things you'll see in thyroid crisis when the TSH levels have jumped up. The patient will start giving you all these symptoms of dryness in the mouth and complete thirstlessness and excessive drowsiness, puffiness of the face, and all these symptoms when they come. And as in thyroid crisis, as is one of the intermittent remedy. Jorgen's syndrome, I have, Dr. Monica is writing that Jorgen's syndrome, I have not, Jorgen's syndrome, I don't think so. Jorgen's, I've had cases, but definitely not, it didn't really help. But tuberculum marmorae definitely helps for Jorgen's. If you are looking for something very outright for Jorgen's, the marmorae helps. But I'll definitely try once again. अगर रियाना मैम आप लिख रहे हो तो definitely कोशिश करेंगे next time. अच्छे से और पढ़ के prescribe करेंगे.
Abhishek, this is coming very close to, we can say, opium or cannabis in the state. So we can have that semi-conscious condition with this typical general features matching. In any clinical condition, after it can be a very heavy effect of sepsis, like in a patient is in sepsis, and if these features are matching, then we can think of it. think.
Okay.
And in certain other pathologies also, when patient is semi-conscious, we can think along with other remedy. This is usually coming in DD,
Yes.
along with opium and even cannabis also.
Okay. Right.
Most of effects are depressing in a way in this remedy.
True.
Yeah.
Next is by Nux vomica.
Nux
Nux vomica discuss
vomica,
करेंगे, छोड़ दे.
तो क्या ही बोले अभी.
तो
हाँ, सब
वाइन वुमेन वेल्थ, वाइन वुमेन वेल्थ. नक्स वोमिका प्लीज सब लोग को मैं बोलता हूँ आज, नक्स वोमिका अगर पढ़ने का है ना, तो डॉक्टर फारूक मास्टर सर का हम लोग ने यूट्यूब चैनल बनाया था. फर्स्ट जो वीडियो मैंने इतना मेहनत करके, उस टाइम पे मेरे को कुछ इतना, आई वाज नॉट इवन टेक सेवी, बट सर का ऑडियो था मेरे पास नक्स वोमिका का, एंड आई पुट अप दैट, I tried making something. It's a very foolish thing, but सुन लो तुम लोग. So if you listen to that, no, I think that is the only remedy when Dr. Master teaches some remedy, one polycrest, once in a lifetime. Whenever you get that, no, you will never forget. Nux सामने आएगा, nux दिखेगा, nux. You will prescribe and you will get 100% success. Come what may ever pathology. Come what may ever pathology.
Yes. Some points to add laterally, if we see, mostly Nux has been used, I have seen being used by most of the practitioners as either constitutionally, if the typical picture matches, and another is in typical GI tract affection, like any acidity or be it a gas, flatulence. Okay. Are you there?
Yes. Yeah. Oh,
yeah.
Sorry.
Fine. Or constipation and all the typical use can be viewed at the level of GI indication, as well as some another set of use can be viewed on a typical mental picture or sort of whole constitutional level. Okay. One interesting use can be for beginner. I am suggesting it. In certain cases, the patient may not be Nux vomica, but as a phase, it develops the state of Nux vomica. So I have used Nux vomica, or the typical state develops as a Nux vomica for time being, for few days, or we can say 1 week or 2 weeks. Patient is in typical state of Nux vomica due to anything. It can be after acute, it can be after allopathic medicine, it can be after a lot of stress. But patient is typically not a Nux vomica. His background may not be Nux vomica. Interestingly, I was treating one patient of depression and anxiety. Right. The constitutional was silica, very beautifully helping. Suddenly, he developed the episodes of anger.
Okay.
His daughter is describing that he's getting more and more angry on it and very sarcastic. So the typical, even how he behaved in a chamber. So I was also surprised that this silica patient is so calm. He was so calm, and how he's behaving like this. So in this type of aberrations, on any other treatment can be dealt very well with Nux vomica. Even it can be during menses also.
Yes.
It can be some after effects of allopathic medicine, or even you can have in children also. Children are getting irritable after having antibiotics and also, but that is for a very short time. And in many cases of allopathic side effects, even not at only GI tract level, but also in skin also. Skin side effects of allopathic also very well covered by this.
Yeah.
Otherwise, जो है वो है.
जो है वो, या नक्स वोमिका में जो है सो है. जस्ट वही के आपने जो लास्ट में बोला कि अगर कोई केस आता है एंड बहुत ज्यादा एलोपैथी लिया है, तो you start with a case.
Definitely.
Maybe you will get better kind of symptoms too, and the picture and the clouds may get cleared up. Okay.
Definitely.
Ocimum can by next remedy is Ocimum can.
Ocimum can, which how I see as a Ocimum can is, it is if you find we used to remember like this in Boric's repertory, there is a renal colic, right side, left side, 3-4 remedies. The Ocimum can is one of the right side, along with Nux vomica and Lycopodium. So it also has a Naxomikas, vomiting and nausea along with renal colic. If we see a very small remedy, mostly picture based on renal colic aspect. The Naxomikas, vomiting as well as nausea with lycopodium's red sand in urine, the typical indication of lycopodium, red sand in urine. And we may not find in every cases this
Yeah.
red sand in urine, but it is being covered, and also a hematuria. These three very different indication we find in a different remedy. We find all those in here in one remedy. So if we are getting this together, so we can give in renal this Ocimum canum.
We have
But somehow Ocimum
yeah.
canum, whenever is coming up, mostly the prescription would be like other remedy. It is coming up in a prescription, but selection would be mostly in other remedies. From my angle, rather it can be a Naxomica. Sometimes it Macphos or something. Yeah.
So Ocimum can Dr. Dode sir, who is a very respected teacher, he had given it as almost specific right-sided. If you find that it is in the right side, ureter, don't think of anything else. With nausea, that's it. Done.
That's it. Yes. Barabar.
Okay. Right-sided ureteric colic. Ureteric colic of right side is Ocimum can.
Ocimum.
Okay. Next time is Onanthic crocata.
Onantha crocata. I have not used a very small remedy. Mostly, majorly, my selection is mostly towards polycrus.
Yes.
Onantha, still, we can say convulsion linked with two things. One is head injury, another is menstrual disturbances. So either the patient is getting convulsion during or somehow before after menstruation, and another link is with head injury, like natrum sulf, right? नेट्रम सल्फ में भी वो है हेड इंजरी और कन्वल्सन का, तो इसमें भी वो है. तो ये एक मेजर उसका इंडिकेशन है ध्यान में जहां से ये आती है. अदरवाइज देयर नो अदर एस्पेक्ट व्हिच आई कैन सी. आप बताओ अभिषेक.
नहीं मेरा the same thing. I have used this remedy genuinely. I had this very since the early days that I used to read these smaller remedies because maybe I'm a little lazy person. That's why I'm doing all this, not the actual marathon and all these Materia Medica marathon things. Okay, and in the same words in Materia Medica, I used to read small remedies first. Polycrest तो ठीक है, कॉलेज में पढ़ा ही देंगे,
वो कंप्लीट
स्मॉल रेमेडीज
हो जाता है ना.
हाँ, बट वो हो जाता है, इसको कोई नहीं पढ़ा. तो यूज्ड टू, and that's when I read Onanthic crocata and indigo. These two remedies are very good remedies to start off when you don't understand actually anything in a case of epilepsy. If you start off in a case of epilepsy, in lot of cases I actually did not have to go anywhere else, but only Onanthic crocata took care of the remedy. Took care of the patient.
For that, just asking for my curiosity, for that convulsion episode or about that time, or you are repeating
No,
for long?
I'm repeating it for a longer period of time. For that convulsion part, I had when we are doing amyl nitrate, I had thought that when the patient is about to get the convulsion, or if the family understands that he's in the aura. So we ask them to smell amyl nitrate mother tincture, and that aborts the aborts the convulsion episode. Okay. And status epilepticus with Dr. Munjal Thakur sir is writing that Onanthic crocata is with profuse salivating. Thank you so much, sir, for giving your vital inputs. And next is oleander.
Even oleander, I have not used many. O वाली जो भी remedies है वो नहीं use किया. फिर भी we will discuss some important points which I have in my mind. Oleander is about mostly the typical effects on GI tract, like producing diarrhea and all these things. And another is like we can have some skin symptom like lot of scalings. The picture of seborrheic dermatitis or even can be a psoriasis when linked with this gastric disturbance. So we can think of oleander in a way, maybe sort of slightly very near to graphitis in a way of oozing and scabbing and mostly scalp is affected in a way. बाकी तो बस oleander.
So oleander again in cases of especially young age people with lot of scalp. I was about to write scalp psoriasis of
Yes.
small children, or the cradle cap, which
हाँ,
we
correct.
call as cradle cap.
Yes.
Cradle cap, what we see, the cradle cap in cases of cradle cap, if you find it with constipation, one of the very good remedies to start with would be oleander.
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 Yes.
Yes, there are a lot of symptoms of. I think there are some of headache, and also I've seen some people using it in headache.
Migraine.
Yeah, migraine headaches, but personally, I have not used it and I have no idea about it. But definitely, it's one of the very good remedies.
But somehow this discussion help us to remind of these remedies in our practice, because we are sometimes seeing this type of cases, but it didn't click us
Yeah.
to give the smaller remedies. Smaller remedies are mostly missed,
Yeah.
though they are not indicating that much frequently also.
Yeah.
But still, they
But sometimes,
whenever they are
yeah, it's good to know. It's good to have some little remedies around you.
yes.
Next.
And one more point on this small remedy. Whenever in majority of cases of our whatever style we are practicing, and the even cases are going well with it. If we are prescribing constitutional patient, chronic cases are very well responding. Some cases will not. Right. Yeah. For example, I usually give constitutional medicine in allergic rhinitis. Most of the patient responds nicely to it. Some patient will not. Even if you change remedy, you might be thinking कि आपका remedy गलत है, तो केस review करके change करते हैं, तो भी नहीं होता. So in certain type of cases, the small remedy works very wonderfully. Like I gave in few patients Sebedilla in allergy patient, so works very well. Even constitutional से नहीं हो रहा था, तो कुछ केस में जहाँ पे अटक जाते तो small remedy काम कर जाती है. So how पता नहीं अपना एंगल कुछ lacking होता है कि might be whatever it is.
True. And maybe sometimes what they need, maybe we don't know. Sometimes what we rightly say is that maybe these are the lesser used remedies rather than lesser known remedies.
Known remedy.
We don't know the real
Yes.
potential of those remedies, so we call it as a lesser known remedy.
Lesser known.
Okay. Next is by Oleum animal.
Oleum animal, Abhishek, I not used in my practice, but I remember cases from Boger himself when I was reading his collected writing cases. उसमें case दिए हैं काफी Boger के खुद के. तो I was able to find 2 cases of Oleum animal, right? So I was studying it, but I didn't find a clue on which basis he gave Oleum animal. There were a lot of symptoms in it. Migraine था, digestive disturbance था, urine का issues थे. मतलब बहुत सारे symptoms थे. But the common thing in both the cases was the odor of urine, fish brine odor. That I think the characteristic of this remedy. And I found in both the cases. Other symptoms were totally different in both the cases, and I was unable to find a typical indication. I was trying to crack down कि बोगर ने ये मेडिसिन दिया है तो क्यों दिया है, किस इंडिकेशन पे दिया है. I use that exercise in my some free time sometimes. In Stalwart's cases, I try to understand ये मेडिसिन दिया रहता है तो समझते कि क्यों दिया, इंडिकेशन कौन सा है. कुछ में समझ आ जाता है, कुछ में नहीं आता. तो इसमें पहली बार देखा तो कुछ नहीं, मतलब when I compare both the cases, this was the common indication in both the things. So that might be the one aspect on which Boger maybe selected this.
Yes.
One aspect is. Otherwise, not used clinically much.
True. I only have had some knowledge where there is there is twist when there is what we say when there is a cord testicular cord torsion.
Twisting. Yeah.
When the torsion or the twisting of testes in young age children, post traumatic, and also so in such cases I have read and I have not had any personal experiences regarding that. Next is by Oleum Jecoris. Oleum Jecoris,
Jecoris, no.
I have a lot of
अच्छा,
personal experience.
मैंने एक बार एक केस में वर्कआउट किया तो ओलियम जेकोरिस आ रहा था. इट वाज माल न्यूट्रिशन का इश्यू था, तो मंगा के रखा था, फिर वो देने को नहीं हुआ था ओलियम जेकोरिस, तो लोअर पोटेंसी में मैंने मंगाया था. बाकी वो तो उतना ही मुझे आइडिया है ये एस्पेक्ट वाला, एक माल न्यूट्रिशन का जो भी है.
Malnutrition. So there is a lot of deficiency and while the patient, but what I have personally, whatever is written. But what I have personally used is when Ranjan Da had made me read that Phatak mein padho, Oleum Jecoris is one remedy which is given to be. Dr. Phatak says apply it locally on ringworm.
Ringworm, yes.
Apply it locally on ringworm. So the Oleum Jecoris, I've used it for that. And also Oleum Jecoris is definitely not is not written here, but maybe I will add it in comment section with a good authentic source that Oleum Jecoris I think has been also used for a lot of pancreatic complaints. But I'll get it with the source. I just don't want to be very random while I'm talking anything about
this I have also read somewhere this external application of this Oleum Jecoris in ringworm, but never used it. But you have used it.
I have used it.
Okay.
And it's a very उसका smell बहुत गंदा है. It's an orange color mother tincture. We are using mother tincture. It's an orange color mother tincture. It smells yuck. I sometimes I'll have to make the medicine. it's very difficult even to make.
मदर टिंचर सब वैसे ही होते हैं. हाँ. मदर टिंचर मतलब सब वैसे ही होते हैं, मतलब difficult to tolerate.
Difficult to manage,
yeah.
So next is by Onosmodium.
Onosmodium is one, we can say, mostly effects on nerves.
Yes.
Nerves in a way. And the effect. This is very interesting, which I look, the Boger, how Boger look at the things. One, he gets focused on one aspect of a tissue first, the nerves and the brain on. And then he elaborated how it affects. Right. So it produces sort of incoordination, also weakness. So we can find it indicative in either a neurasthenia, weak states. Sexual fear is mostly affected nicely. A sexual neurasthenia, sexual weakness, impotency also, and some gait disturbance also.
Yes.
Along with some nerve affection. And one interesting aspect about Onosmodium, which I have read in Phatak's own cases. He was treating one case of impotency. The patient used to perform sexually with his it was difficult to perform with his wife, right? And he was very well okay with the other women. This was the complaint of patient. I have difficulty with sexual relation with his partner, wife, and no difficulty with other ladies. तो फाटक ने rubric देखा था psychic impotence. Psychic impotence. And the only one remedy given, Onosmodium and Borix material.
Yeah.
So it is very interesting aspect of it. But the general thing is on the effects on sexual sphere nerves. The effect is either incoordination plus a weakness. So neurasthenia plus incoordination.
Yes.
And as a sphere, we can say a typical nervous system of like a gait, and even sexual aspect of impotency and all sort of erectile dysfunction things.
So psychical impotency with left-sided migraine headaches, which is very
migraine also. Yes, migraine also very well.
Yeah. So that is all about, I think, and even it can be used in cases of nystagmus and strabismus, like what you
eye strain,
eye strain, and young age. Then there is these complaints. Another important remedy is benzene dinitric.
Many doctors are using in even myopia also. Yeah. When these are the numbers are coming fluctuating in teenagers and not settling down. Onosmodium is being used for that also.
Yeah. And when you mentioned boric, I could just recollect that benzene dinitric is one remedy which is given for nystagmus.
Nystagmus.
Benzene dinitric. Yeah.
Mhm.
So next, go to the next remedy, opium.
Opium. Okay.
Again, a very, very large remedy
Large
with large remedy
indication.
with multiple level of, I think, indications. We'll just highlight up wonderfully, just let us know 4 or 5 things which you have wonderfully examined, like in multiple times.
I have given mostly in alcoholism, alcoholics cases, and for constipation also. And not I have personally given, but during my training, I have observed a lot of implication in coma cases when we were in training or MD.
Yeah.
So we have observed many cases of opium given in coma because usually we don't treat coma so frequently in our routine OPD practice. But during my training time, I have observed many cases of in coma. Another is of constipation, a typical opium constipation, and other is this. What I have said is I forgot it. Yes, ailments from fright also.
Yeah,
which
ailments
is
from fright.
Off track to a typical opium state, which we find it very overpowering sleep and comatose sleep and downwards depressing effects at all the organismal level. But the ailment from fright is affecting opium so much.
Yes.
But the differentiating point, even ailment from fright in aconite also.
Yes.
That is also a strong causation in aconite. Aconite mostly it is like fever-like effects, ailment from fright. But in opium, it is depressing effect. It is a shock. It acts like a shock. So you may have certain type of like suppression of urine or that sort of pathology after ailment from fright. So we have studied in one of a session from our teacher. The case was of one young boy. वो ऐसा उंगली कर रहा था कुत्ते को, ऐसा शांति से कुत्ता बैठा था तो वाव किया तो patient was so much frightened by it, then urine was suppressed by it, and with opium it came very nicely. So this is one aspect of it.
One aspect. And when you're just comparing it with aconite, no, I'll just sorry to interrupt you, but that I could just recollect a case that, as you rightly said, that the reaction of ailments from fright to aconite is very superficial, is very on the very surface, on a very surface level. But of the opium, no, it can get deep down into the pathology. Once I can just, in a very short, I'll just say in 30 seconds about that case, that I had a case where I was suspecting some kind of a deeper pathology in the intestine. I had given opium and the patient felt better. I said, better लगा है ना, CT abdomen करवा के आना. तो he said, sir, better हो गया तो CT abdomen गया. I was so confirmed that अगर opium ने help किया है ना, तो deeper pathology निकलेगा. And then there was definitely a deeper pathology in the intestine. We got some positive findings on CT. I said, so this is how I can relate to this part of what you said, that aconite is little bit
depressing.
Opium is very deep. The pathological changes are going to be very deep inside,
and it sort of suppresses the functions rather than exciting it. In all the things, there are two aspects of opium. One is excitement and one is suppressing. But what we are seeing as an indication, those indications are mostly suppressed ones, like the comatose condition, sleep is suppressed, there is a constipation, urine is suppressed, perspiration is totally gone, and all those things. Another aspect of it is very agile patient, vigilant patient, and hypersensitive senses. That's the very counter state of it.
Yes.
We may find it in some state of the opium patient sometimes for a time being. And painlessness is the one characteristic.
Painlessness is a characteristic.
Painlessness. वो very we can relate it with this. Painlessness उसका basic ये है, material effects है. तो जब I was studying it, युद्ध करते थे ना पहले राजा तब ये ओपियम लेके जाते थे युद्ध करने के लिए. In battleground, all the soldiers were using the very typical fixed dose of opium before fighting to get painlessness.
painlessness, so that they would
वो
not
भी
be
जो
hurt.
yes, तो वो भी वो हम
वो,
देखते हैं ना टीवी
yes,
में या तो सीरीज मूवी में इतना युद्ध करते हाथ बात कट जाते हैं वो तो ओपियम का इफेक्ट होता है तो वो they might be having a tolerance for that also.
Yes. Like what the first line Bogan mentions, no, is about negative torpid states. Now, negative torpid states in the current situation, what we can think of is, no, is lot of depression cases comes to us. A lot of patients will come to us with depressions and taking depression cases with antidepressants, 4, 5, 6 antidepressants. I find it very good to start opium in LM potencies with such cases.
Okay.
Later on, when you start tapering down with antidepressants in the coming time, you see definitely the picture will change because there is a lot of suppression with antidepressants.
Yes.
But this negativity, this depression, is very well treated with opium as an opening remedy. Like I'll tell you, as an opening remedy for depression cases, you'll see wonderful results. In very short time, patient starts developing confidence that yes, all these days, because see, a remedy will the antidepressants are also going to cause a lot of sleepiness, which is also also one of the indication for opium.
So this is the complex cases, right?
Yeah.
So we may not find the original picture. Yes. And mostly what we have is the mixed picture of allopathic medicine plus disease symptoms.
Yes.
And most of the allopathic medicine can produce this type of situation like this.
Next is by osmium.
Osmium comes up in mostly DD in coughing to my cases. Whenever it is coming, my prescription would be Coccus cacti rather than osmium, right? So it mostly comes up when there is a spasmodic cough with tenacious mucus, difficult mucus in expectoration. But in this, somehow I biased with Coccus cacti in this type. But mostly it comes up in DD with Drosera also.
Drosera,
Coccus cacti
also. And Iodium also.
Coccus cacti also. So वो एक इंडिकेशन है. अनदर इज बोगर का एक केस था, बोगर ने दिया था फॉर पोस्ट नेजल कैटार rather than coughing. It was the post nasal dripping. Patient used to get this coryza as well as obstructed nose feeling like Nuxvomica. It is similar to Nuxvomica in that there is a coryza but there is a stoppage feeling. So this two aspects and typical aggravation of use of voice even from talking like phosphorescence something. So might be useful in mostly acute coughs to my point of view. Not used in any other pathology or indication.
But Jitesh bhai is writing glaucoma, तो अगर Jitesh bhai बोल रहे हैं तो glaucoma के लिए होगा remedy.
Yes. Glaucoma.
Last remedy for the day, oxalic acid.
Oxalic acid,
I find it is more important for pseudo-cardiac pains. Like
thinking of complaint aggravation.
Thinking of pain starts aggravating the complaint. So when they start complaining of the any rheumatic pains, they get rheumatic pains. When they start complaining of any heart thing, they start experiencing cardiac pains.
Yes, I think it's written in tissue. Cerebrospinal axis or something.
Yes.
Right.
Yes.
So cerebrospinal axis has been written in very few remedy in Boger. Cerebrospinal axis. So it works through this, the thought of thinking of complaint, and again through the whole nervous system, patient is getting the feeling of pain or pain is aggravated. Cerebrospinal axis plus that characteristic of thinking of pain or thinking of complaint aggravation. If we see, Abhishek, we have discussed many small remedies. I can see there can be two type of. One, you are having a very solid type of indication, right? So this is the organ, this is the pathology, these are the keynotes, and this is the remedy. Some remedy may not have those type of solid indication, like the oxalic acid. So this is very strong that thinking of complaint aggravation, but we are not sure about pathology or
Yeah.
the typical location, how like other smaller remedies indicated, right? So I can see if we want to use it, we can get entry into this type of remedy through this thinking of complaint aggravation और अपना जो pathology है वो cover हो रहा है क्या? And we can try it.
Yeah, but I think again, so like what everybody is writing is true, that pain in spots like Kali
Yeah.
Bai, that's true. And what is really important here is just that maybe because it's a very superficial remedy, so there are no deeper pathological symptoms
Yes.
mentioned in any materia medica.
Find
So
very
maybe
scattered
yeah,
indications.
scattered indications. So that is all about oxalic acid also. Thank you so much.
Fine.
Nah,
Learned a
thank you
lot.
No. We learned a
Discuss.
lot. We learned so many things, and especially from all our co-participants who constantly have always
Definitely.
been very supportive. Jitesh Bhai, Rehana ma'am, Vansh, Shwet, you also contributed a lot today. Ranjan Da, I can't, and Ashi Jain, she also contributes a lot. Atul Bhai, everybody. I'm sorry if I'm not naming anybody, but these are the names which I always see. So thank you so much,
But
everybody,
thank
for
you
joining.
again.
Thank you, Zamin,
Yes.
for joining us. Thank you so much. See you someday in Gujarat. I'm
Sure.
Junagadh.
आओ. आओ
Chalo,
बढ़िया.
chalo. Bye. Good night.
Sure.
Mariye પછી.
Okay. Bye.
Bye.
Good night, everyone, and thank you all for listening us. And again, Abhishek, thank you very much.
Yeah. Bye.
Okay. Bye. Bye.